This isn't just another Ebola outbreak. It's moving faster than anything health officials expected. More than 4,000 infections, thousands of deaths, and now fears the virus itself may be changing. In Central Africa, the race is no longer only against Ebola, it's against time. "4,000 cases in, and the virus behind one of the deadliest Ebola outbreaks in history may be changing shape. Health officials in the Democratic Republic of Congo say the strain driving the current epidemic could be mutating, as confirmed infections passed 4,000 this week. Africa's public health watchdog declared on August 6 that the time for incremental action was over, announcing plans to scale up every part of the response, including a door-to-door search for undetected patients.
We have planned studies to check if there is no additional issue, or maybe if the virus is not mutating, because the level of severity of this Bundibugyo outbreak is unprecedented.
The outbreak, caused by the Bundibugyo strain of Ebola, was first reported on May 15th, though officials suspect the virus may have been circulating undetected since January. By August 4th, the DRC's National Public Health Institute had recorded 3,973 cases and 1,801 deaths. Speaking days later, the Director General of the Africa Centers for Disease Control and Prevention confirmed the case count had since crossed 4,000, calling the severity of this outbreak unprecedented.
I think one thing that's different about this outbreak is the unprecedented speed. It's moving really, really fast. And I can't hide it from you, my feelings. Maybe expressing my feelings properly would be better. I'm deeply, deeply concerned by how the situation is on the ground. It has, of course, Ituri is the epicenter. But already, as you have seen in the report, 5 provinces have been affected.
The scale now rivals the deadliest Ebola epidemic on record. 11 weeks in, this outbreak has produced 8 times more cases and 6 times more deaths than the West Africa epidemic of 2014, a crisis that would eventually kill more than 11,000 people. More than 2/3 of deaths are occurring outside treatment centres, in homes and communities, rather than under medical care. At one treatment facility in Ituri province, 9 in 10 admitted patients had never appeared on any official contact list, a sign that the virus is spreading largely undetected beneath the surface of the response.
It can be stopped, but we need to do the right things. We need to do it with speed, and we need to be faster. Not as fast, actually. Unless we're faster, we cannot catch up. It's ahead of us. It's moving fast, and it's ahead of us. We're playing a catch-up, but from a very far distance now. It's far ahead of us. So we have to move faster in order to catch and stop it.
Officials say contact tracing has fallen far short of what is needed, identifying only a fraction of the contacts expected per patient. In response, teams are shifting strategy entirely, moving from tracing known contacts to actively searching communities, door by door, for anyone showing symptoms. Plans are now underway to introduce antiviral treatment on compassionate grounds, alongside trials testing whether an existing Ebola vaccine, though built for a different strain, could still offer protection against Bundibugyo.
Could prioritize the ones with the cameras, and everyone else would protect the sites so that
So the major concerns as of today are that, one, we need to strengthen the response in the DRC so that we can be able to reverse the transmission and be able to bring it to a halt, because there are now close to 4,000 confirmed cases since they declared the outbreak in May, and about 1,600 deaths have been registered But working together, we should be able to contain that outbreak.
Welcome to this press briefing.
So let me start by thanking the Ministry of Health and the partners for the successful interruption of the Ebola transmission following an effective national response led by the government of Uganda with the support from local communities and partners. We pay tribute to the frontline health workers, affected communities, scientists, and response teams whose dedication made this achievement very, very possible. You said it correctly, Honorable Minister. While the immediate outbreak has been controlled, continued vigilance remains very essential.
The Minister of Health.
The other concern which we've been raising as government of Uganda is that we urge the countries which had instituted travel restrictions for their citizens coming into Uganda, but also for people traveling from Uganda accessing their countries. In light of the progress which we have registered as a country, we appeal and are engaging those countries to lift those restrictions. In any case, from a public health standpoint, those decisions are not backed by science.
We leave tomorrow with Uganda's experience, which provides valuable lessons for strengthening epidemic preparedness and response across our continent. The Ministry of Health, Africa CDC, WHO, and all other partners remain committed to working together to advance this regional and health security. Honorable Minister, you touched about travel restrictions. Let me just add, travel restrictions and border closures have got no scientific backing that they're effective in controlling outbreaks.